Pop quiz. A nurse is caring for a patient with acute pulmonary edema. Arrange the following nursing interventions in order of priority to manage the patient's condition. 1. Administer furosemide Lasix IV as ordered. 2. Place a patient in high phallus position. 3. Administer O2 via non-rebreather mask. 4. Insert an indwelling urinary catheter. And 5. Assess the lung sounds and monitor oxygen saturation. I'll give you guys a second to think about the order that you're going to perform these nursing interventions. All right, so your patient's having an acute pulmonary edema. And I know what you're thinking. Many of you guys were going with number 5 because you're thinking, okay, nursing process assess. Remember, you're assessing when you don't know what's wrong, right? But in this case, we know what's wrong because when you're assessing, you're getting information to try to figure out what's wrong. In this question, they already told us what's wrong. The patient's having pulmonary edema. And guess what? It's acute. It's right now. The patient's experiencing this trouble breathing right now. So the first thing you're going to do, whenever a patient's having breathing issues, and I don't care, it could be pulmonary edema, it could be emphysema, it could be bronchitis, it could be asthma, it doesn't matter. If they're having trouble breathing, the first thing you're going to do is sit them up. Why? You want gravity help push down that diaphragm and so the lungs can expand. You want them sitting up so that abdominal girth is pushing up against the lungs. You want perfusion to increase, right? So you're going to sit them up. That's the first thing you're going to do. After you sit that patient up, then you're going to administer oxygen. Because they're getting oxygen, the oxygen can actually go somewhere because you sat them up, right? So after you sit them up, you give them oxygen, then you're going to assess. Then you're going to do number 5 because you just did that nursing intervention. You need to know if it worked. How are you going to know if it worked? Look at their O2 sat. Listen to their lung sounds, right? So after you do that, you're going to go ahead and give them the Lasix as ordered while we're trying to get that fluid out the lungs. And then last, you're going to insert that urinary indwelling catheter.